All right, hey there, Dr. Erickson, EHS, physical therapy chiropractic, also the herniated disc expert. So with the group that we have and the YouTube channel, all that kind of stuff. So I wanted to give you some more information. And we've got Dr. Jake Anderson here with us as well. So we often see the question about degenerative disc disease, degenerative joint disease, so the DDD, the DJD, and then other terms like disc herniation, disc protrusion, disc bulge, and in reality, and I mean honestly, it can get quite confusing and quite scary. You know, if you're going through that, what does that mean? Are some things like others? Are they all the same words, you know, for the same condition, or are they different? So, Jake, take us through kind of what. Let's start with the degeneration part, and then we'll go to the bulging part.
Yeah. So, in essence, these are all very similar things that kind of go hand in hand. So if you've ever had an X-ray or an MRI of your back or neck, it's likely going to have these findings, no matter what age you are. So even if you're 18 or you're 43 or you're 59, like whatever it is, you're going to have some signs of degeneration. So at the end of the day, it's
just different variations or levels of that.
Yeah. So you can think of it mostly as like age-related changes in the spine. It's no different than getting gray hair. Everything can still function the same, even though it looks a little different.
I've got more of that. I've got more of the gray hair.
So when we talk about degeneration specifically, it usually means a little bit of a narrowing of that disc space. We've got the two bones here. We've got the disc in the center there and the nerve root. When we start to have signs of degenerative disc disease, that just literally means a narrowing. It doesn't necessarily mean that there's any bulging going on. It can have a little bit of like bony overgrowth called osteophytes in the spine.
Or ridging.
Yep.
And so we're saying that like on an X-ray, that's going to look bright white. This will be kind of black and bright white. So that decrease in space, you just lose that over time as you get older. It's why we get a little bit shorter as we get older. We just lose that space a little bit.
Yeah. And just because you have that, it's important to understand that just because you have a sign or an X-ray that shows you have degenerative disc, it doesn't necessarily mean that you're going to have symptoms or have pain. In fact,
there's no correlation between
yeah,
degeneration and natural degenerative changes and more or less pain in people.
Yep.
Yeah.
And I'd have to check these exact numbers, but I believe it's over 70% of the people that show those degenerative changes, that DJD or that DDD, have no symptoms at all. So even though you have those, it doesn't necessarily correlate with the pain that you may be experiencing. But if we pivot here and go from the degenerative disc or DJD to like a disc bulge or a disc herniation.
And so really what we're saying here,
let's chat about that.
So the joint, the DDD has to do with like degenerative age-related changes to the disc tissue. The degenerative joint disease, which now that one, because the bone and the disc of the bone make up an actual joint, those are really right on top of each other. Like they could be talking about the changes to the disc tissue, or they could be talking about the changes to the joint, like Jake was saying, that edge of the bone gets some spurring. It might look a little bit brighter white on an X-ray because there's some osteophytes and some ridging and that kind of stuff. So those two are very similar in nature. But the actual disc injuries, disc pathologies could be like bulging, where there's a little bit of tissue that's taking up space it's not supposed to be in, although it's still contained within the annular wall. So when this thing is taking up space it doesn't belong in, okay? So let's get that thing kind of like that, right there. Hopefully that zoom there, some clarity. So that could be a bit of like a bulge, right? So something's taking up space that doesn't belong in. It may or may not irritate the nerve root, right? So it doesn't have to. It could just be discogenic pain where you just feel it just in the back, just off to the right, just off to the left, right in the center. There could be some things here that just would be centralized pain. If that nuclear material escapes the annular wall and there's some tearing, or it's like actually protruded through or herniated, where it's escaped the annular wall, that's a different level of disc injury. And really, what we have, no, I shouldn't say we, because we didn't find it. What we have read from different studies is that the larger the herniation, the big ones that just like they just spill out into the joint space and they're really bad, actually tend to heal and resolve faster, quicker, non-surgically, than ones that are small. Because of the fact that your body recognizes that, now we're really blurry, wait a minute, there we go. Because of the fact that your body recognizes the, that injury, that, what do I call it?
It's just the inflammatory
yeah,
response that initiates
it's
the
so
healing
it's so
process.
big and so bad that your body like recognizes
Goes to
the
attack.
insult,
Yeah.
that
There you
whoa,
go.
I have to send all kinds of my body's natural
Macrophages.
fighting, macrophages to eat the thing up and white blood cells and try to like heal that and calm that down. That's why the big ones tend to. I mean, it's painful. Don't get me wrong. It's very painful. It can be all the way down the leg. It can be debilitating, but they do tend to turn around with the right movements. So, anything else you want to say on like disc bulge versus disc herniation versus disc protrusion,
Probably
sequestration? Like there's all kinds of different
Yeah.
levels of.
Most people or most patients will use the term pinched nerve, which is essentially what Chris demonstrated there, where a piece of that bulge or the piece of that disc tissue actually presses on or compresses that nerve root right in there. And that's what causes sciatica or shooting pain down the arm, shooting pain down the leg. So reducing that bulge and restoring range of motion is one of the keys to getting those symptoms to go away. And it's important to understand that, these are scary terms: disc bulge, disc herniation. There's a lot of fear that surrounds those, where people think, oh, my back is shot. I've got a bad back. I'm never going to recover from this. I'm going to hurt for the rest of my life.
Or I have to have surgery. Or, it'll never heal.
And that's not the case. Like 97+% of these people are going to have great results without surgery, without drugs. So it's important when you start having symptoms in the back or the neck or even down the arm or leg, you need to start working with someone.
This can happen in the neck as well. This is a lumbar model, but it can happen in the neck just as easily.
So if you start having these issues, address it early, because those that address it early, you tend to respond quicker and heal faster than if you just let this thing manifest over days, months, years, and then it becomes harder to change. So the sooner you address these issues, the more likely you are to have a quick and successful recovery.
Early movement. Early intervention, meaning get with somebody who knows, what they're doing in this situation and can quickly assess and get you on the right, path and direction. And because it's not just picking any movements. Some movements can make you worse, some can make you better. So there's really no one thing that everybody should do, because everybody's problem is individual and specific. So it's hard to say like, well, everybody do, flexion, or everybody do extension, or everybody do a certain stretch. That's the common question we get too, is what exercises fix this? Well, it depends. It depends on how you mechanically and symptomatically
respond.
Cause and effect. What happens when you do it? Oh, I feel better. Okay, keep going. But it may be different than the one I use, it might be different than the one that Jake uses to get that pain. The other one I want to talk about is, so when we talk about maybe some degenerative joint disease along with, what if we had a combination? So that could mean,
which is common.
Like
you often do have a combination.
So the space is now reduced, right? So I already have a little bit of reduction of the space, and this hole right here, so it's another term we didn't talk about, but that could be a stenosis, meaning that hole is now smaller than it was in the past, and there's still enough room. As long as I have enough room, nothing's bothering that nerve root. But now once I add a little bit of like disc material or bulge into that space, now there's not enough room. So is it the disc? Is it the stenosis? Is it both? Like which one? So that's what we have to kind of help you figure out, because it could always be there. You could always have had a stenosis for a long period of time, but no symptoms. But now all of a sudden you wake up, it quickly gets worse.
It's narrowed even further.
It's narrowed even further. Now there's not enough space. Also, just anatomy and the size of the nerve root can be a problem. Some people have really big, thick, roots, and some have really stringy, small ones. And so even though the picture could look bad, there's degeneration, there's a bulge, but they're like, no, I don't really have any pain in my leg. It feels pretty good. Then it's okay, because there's enough room that it's not bothering that nerve root. So I just wanted to, that's a little bit down, deeper down the rabbit hole than maybe for this video.
But you keep going up here.
Yeah, but it's good stuff to understand, how that all works. So that's the difference between those.
That's a big overview then of, we talked about degenerative disc, degenerative joint disease, and then disc bulge versus herniation versus sequestration. There's a lot of different terms. At the end of the day, they all pretty much mean a similar thing, a narrowing the joint space that is potentially reducing symptoms. So if you have something like this going on, reach out to us. We'd love to help you, or we can at least point you in the right direction of someone that we may know, or hook you up with someone that can point you where you need to go.